attitude of policymakers, biomedical personnel on the integration of traditional healers into the South Sudan national healthcare delivery system. This study will focus on two counties, Yei River County and Juba County of Central Equatorial State in South Sudan. Let me hope you are hearing me clearly before I proceed.
Yes, please proceed.
Okay, thank you.
Yes, yeah.
The background of this study is when you look today that the value of traditional medicine for health and well-being is really widely spread and has been recognized by the WHO. And according to the Almata conferences on primary health care of 1978, which deliberate on the issues on integration of these traditional healers into the national healthcare delivery system. Major of these include the traditional birth attendants and its importance on integrating. However, although this has been recognized that the integration of traditional medicine into the formal healthcare system is an urgent need, there is no laudable attempt which has been made to involve traditional healers. Now, what is the problem? Why am I doing this study? South Sudan itself, the healthcare system is struggling with the serious issues, especially in the rural areas where access to biomedical is severely limited. And these challenges, this has given challenge and difficulties of traditional medicine has been merged as an essential resource because there were no in rural areas access to the modern healthcare system is really having challenge in the Republic of South Sudan. And with this, traditional medicine become one of the paramount that the community uses. And but despite the widespread of the use of the traditional medicine, there remains a significant gap to understand of how traditional healers might be included in the South Sudan healthcare system. Therefore, this study intends to explore the perceptions and attitude of policymakers and the biomedical personnel who are the doctors on the integration. If we are to integrate this traditional healer into the national healthcare system, what is their perceptions? What is their attitudes towards the integration process? The purpose of this study is actually to explore the perceptions and attitudes of policymakers and biomedical staff toward the integration of these traditional healers into the national healthcare system in South Sudan. By understanding the perceptions, and then this study will aim to contribute to the uniform policy decisions and the development of effective strategy for integration. So this study, if goes successful, will help policymakers to guide towards the integration of these traditional healers into the healthcare system. My research objectives look at determining the perceptions and attitude of traditional healers. 2, the perceptions and attitude of the policymakers. 3, to understand the perceptions and attitude of the biomedical personnel. 4, to determine the community perceptions. All these 4 stakeholders, what are their perceptions towards integration? If we are to integrate traditional healers into the modern healthcare system in South Sudan, what are the perceptions of these 4 policymakers? And then finally, to propose a model for integration. This will be based on the findings. The finding will be able to give us an informed decision on which model is best fit for the integration of traditional healers. The research questions are the same, going in line with the objectives, I think. The significance of this study. What is the importance of this study and why? We find that it will provide a detailed account on the perceptions by policymakers within the South Sudan government regarding the benefits. When we are able to do this, then the policymaker will be able to understand the potential benefit, challenges in the implementation of the traditional healer. It also can give a comprehensive understanding of the attitudes of the biomedical personnel. This includes the doctors, nurses, on how they feel when this integration is to be done. And this normally will focus on efficacy, safety, and the cultural relevancy of the traditional medicines in practice in the context of modern healthcare. The research will anticipate to identify specific barriers and the facilitators that are perceived as both policymakers and this. What are the barriers towards this? And then the study will explore the perception of policymakers regarding the model of integration. And it can also be used for ethical considerations in this. Theoretical framework. This study will focus on three major theories. One, the social ecological theory, a social ecological model. And we say this theory states that health and healthcare decisions are employed by a complex interplay of factors operating at multiple levels. This level include the individual factors, such as the beliefs. Actually, we're looking at this, look at the beliefs and attitude of the policymakers and the biomedical personnel towards the integration. This ecological model we look at. And then the theory of the planned behavior. This suggests that behavioral intentions are shaped by three key factors, which can be attitudes towards the behavior. That in this case, we look at the collaboration. What is the attitude of the policymakers? What is the attitude of the biomedical personnel towards the collaboration, the subjective norms, and many others? And then the stakeholder theory. This analyzes the various groups who are interested in or are affected by the integration. The study will actually look at the four stakeholders, the policymakers, the traditional healers themselves, the community, and the biomedical personnel, the four stakeholders. These are the key stakeholders that are either affected positively or negatively towards the integration. And the study will focus on these three theories. The conceptual framework, we look at the independent variables, which are the policymakers' perception, biomedical perceptions, community perception in their contextual perspectives. Under these policymakers' perception, the study will look at the regulations and the policies that the policymakers will make towards the integration. And then the training, the certifications, and even the financing of this integration process. Under the biomedical, the study will focus on the attribute of communication. What is the communication link between the medical personnel and the traditional healers? Because the aim here is to save the lives of the people. So how are they? In the quality of care, the standard of the service be given, and even the knowledge of the medical personnel towards traditional medicine. And then under the community perceptions, the study will focus on satisfaction. Are the community really satisfied with the integration? Are they satisfied with the biomedical personnel, biomedical system? Are they satisfied? What is their preference? And then is it accessible? This is something that we look at. And then at the contextual perspective, we look at the rural and the urban. Which population in the country actually go for traditional medicines? And why? Which age group? Which gender? These are things that the study will be looking at. And all these will sum into improve traditional healers integrations. And under the integration, when the integration the model is developed, and then it will be able to give an access to quality services delivery for all people. The study will focus on literatures. It will look at the literature, which will look at the policymakers' perceptions, especially the one done by M.G. Picon, and then the biomedical perceptions, study being conducted in Eritrea, towards this perception, traditional healers, and also integration of traditional healer in other countries. And the study areas will be Ghana, Nigeria, and we'll also look at how India has really used the traditional medicine. How is their connection between the traditional medicine and the modern medicines? That is the literature that we'll be focusing on. The methodology. This study will focus on this methodology. The research design will be a mixed method approach where both qualitative and the quantitative data will be collected. Remember, we're looking at perceptions, and perceptions need an insight that we could get from the people. And then data will be gathered through key informal interviews, focus group discussions, and survey. Those are the tools that can be used. The geographical location remain the same. And then two sample size. The total sample size will be 779. People may say this is ambitious. This is ambitious because the sample look to be big, but the study is made in a way that it is done in stages because the stakeholders are different. So in this, Fisher's formula of 1986, as indicated, will be used to determine the sample size for the community members. And then Solvenia's formula of 1960 will again be used to determine the sample size for the biomedical personnel, the medical doctors in the two counties. And it is estimated that health workers in South Sudan are only 4,200. This has been equated that health workers per 10,000 population, because South Sudan has a population of 12 million people. So this is really a gap. The health workers are even less. And the distribution of the sample size will be as indicated in the table. Policymakers, the type of questionnaire will be key informant. 15 will be in Juba County, which is the capital of the county where the Minister of Health is based. And then 5 will be from Yei River County. This is a small county where the ministry is not based, but only directors. And then the biomedical personnel, the method will use survey questionnaire, where 172 medical personnel in Juba County will be interviewed, and 173 in Yei River County will be interviewed, which make a total of 347 and 45. Traditional healers, South Sudan really has challenges to get with the registered number of traditional healers. So this will be an estimate of 30 traditional healers, because the recent discussion I had with one of the traditional healer and the traditional chief is, at least in each payam, a payam is like a smaller, a bigger area. A payam might have at least 4 to 5 traditional healers. So this will be an estimate, and then the community members will use both survey and the focus group. Focus group discussion will be used for the community members, and that is their sample size. Sampling method, simple random sampling will be used, especially when selecting the medical personnel and some of the community members. Purposive sampling method will be used for the policy makers, and snowball sampling will be used for the traditional healers. Data analysis, SPSS will be used for the quantitative data, and semantic analysis and the terminological analysis for the qualitative data that will be developed. Reliability and validity of the instrument will be done, and the pilot study will always be conducted before the actual data collection to test the reliability and validity of the instrument. The inclusion and exclusion criteria. The inclusion, all adult male and female will be part of this study. People who are consented and are willing will be involved. Policymakers in the Ministry of Health, traditional healers, biomedical personnel, and the community members will be part of this survey. The exclusion criteria will be those who are not willing to be part of the survey may easily be excluded, and those who do not consent. Children under the age of 18 will not be part of this study. Thank you.
Thank you for the presentation. Any question or comment, please? Any question or comment? No clarification? Hello.
Yes, hello, I'm getting you.
Okay, I have a question myself. Why have you excluded the chiefs?
The chiefs are part of the community members. They will be interviewed as part of the community.
Chiefs are stakeholders in this study,
Okay.
of which is important for them to be of their own independent submissions. We can't include the chiefs and the community.
Okay.
Because chiefs are stakeholders. This is my view.
This is noted. Thank you.
Okay, if there is no question, that's guided area.